Hello everyone, this is Group 3. So, let's start. Our topic for today is all about analgesic. In next slide, it shows here the presentation outline. Introduction. Analgesic, any drug that relieves pain selectively without blocking the conduction of nerve impulses, markedly altering sensory perception, or affecting consciousness. This selectivity is an important distinction between an analgesic and an anesthetic. Next is the examples of analgesic. Analgesic is a medication that relieves different types of pain, from headaches to injuries to arthritis. Analgesic includes the four main OTC pain relievers. First is the acetaminophen. Acetaminophen is best for combining. Mostly, it is for both fever reduction and will help to ease pain. So, acetaminophen has fewer side effects. Second is the aspirin. Aspirin derived from salicylic acid. It is best for heart health. Non-steroidal anti-inflammatory drugs or NSAIDs, such as ibuprofen and naproxen. Ibuprofen is best for quick action. These pain meds works better because it decreases inflammation in the muscles and joints. Lastly, the naproxen, best for chronic pain. There is one example of NSAIDs that's no longer widely used in many countries, which is the pyrazolone derivatives, because of their tendency to cause acute infection known as agranulocytosis. Mechanism of action of analgesic. Aspirin and NSAIDs appear to share a similar molecular mechanism of action, namely inhibition of the synthesis of prostaglandins, natural products of inflamed white blood cells that induce the responses in local tissue that include pain and inflammation. In fact, aspirin and all aspirin-like analgesics include indomethacin and sulindac, which are derived from a heterocyclic organic compound known as indole, inhibit prostaglandin synthesis and release. Clinical uses. Analgesic is used after surgery or due to injury, such as fractured bone, for acute pain, such as twisted ankle or headache, for aches and pains like menstrual cramps or muscle soreness, for chronic painful conditions such as arthritis, cancer, or back pain. Warning and precautions of analgesics. Do not take painkillers if you drink more than 3 alcoholic drinks per day. Do not take ibuprofen if you have stomach ulcers or are taking blood pressure medications. Be cautious of taking cold medications if you've already taken pain medicine. OTC products like naproxen are in the same class of ibuprofen and should not be taken together. Side effects and interactions. Ringing in your ears, dizziness, and constipation, stomach ulcers, trouble forming clots in the blood, which can lead to excessive bleeding. Toxicity in taking analgesic. Potential liver and kidney damage. Increased risk of heart attack or stroke. There is no antidote available for NSAID poisoning. Aspirin carries both significant adverse effects in therapeutic dose and a substantial risk in overdose. Objective: to study the effect of various analgesics on pain sensitivity to the thermal stimulus using hot plate. Rats and mice are the choice of animal for this experiment. Materials: hot plate, evaporating dish, and cotton. In this hot plate method, we use heat as the main stimulus or source of pain. Procedure: insert the main lead into the socket. Switch on the hot plate apparatus and wait until the plate reaches the defined temperature. Clean the metal surface with disinfectant. Wait a minute to re-establish the surface temperature before commencing with the test. Put the first mouse on the plate and simultaneously start the stopwatch to measure the withdrawal latency. Stop the stopwatch after the mouse displays any reaction to heat. If the mouse does not react to heat after 30 seconds, it is removed from the hot plate and the 30 seconds is considered as latency by default. The hot plate and evaporating dish are cleaned with water and disinfectant. At the end of testing, return the mice to the housing rooms. Calculation of dose to be administered. Conclusion: most analgesic used for mitigating pain. To study the analgesic activity of given drug in mice using hot plate method. So based on our observation, the analgesic is effective on the rat, but it is short-term because it takes 10 seconds before the rat feels the pain and shows responses to paw licking and jumping. That's all. Thank you for listening.